Good evening, once again to all our viewers, and welcome to the CII Western Region Startup Buzz. As you all know, we host this every Thursday, 5 p.m., and we are well into our 50s. We've been doing this for 54. This is the 55th week, if I recall correctly. And this evening, I'm happy to introduce Aarti and Bhavjot. Aarti will be steering the conversation, and Bhavjot is on the hot seat. Without further ado, I'm going to hand it over to Aarti and Bhavjot to introduce themselves and set the ball rolling this evening. Thank you. Over to you both.
Thank you. Hi, all. Welcome to CIS Startup Buzz, where we get up and close with the founders who are quietly reimagining India, but one problem at a time. Quick introduction. I am the Vice Chair for Maharashtra State CII, and I also lead India lead for government advisory and strategic partnerships for Accenture in India. So, today's conversation is something which I have personally been looking forward to. Our guest founded a company not from a boardroom inside, but from a personal loss. She left a high flying career in the oil industry, literally working in Iraq and Borneo, to come back and fix something broken in India's healthcare system. An IIT Roorkee alumna, she leads clinics, work across health hubs, care delivery, insurance partnerships, and growth. Under her leadership, Clinic has served more than 400,000 lives, combining primary care, preventive health, and financial protection into a scalable model for everyday healthcare. Her focus is on building healthcare that is measurable, empathetic, and designed for real world Indian families. Please welcome Bhavjot Kaur, co-founder and CEO of Clinic. So Bhavjot,
Thanks,
hi.
Aarti, for having me. It's good to be a part of anything that CII does. You guys have been doing a lot of great work on policy. And also, I too follow your shows, some interesting, candid conversations for the industry leaders. So thanks for having me. It's a pleasure.
And thanks, Bhavjot, for that quick take on CII's championship in many, many initiatives that actually helps grow not just the state, but as a nation. Bhavjot, most people in this room know Clinic as a healthcare startup, right? But I want to start at the very beginning, the real beginning. Your father passed away from complications, and your family lost their savings fighting his illness. That's not a footnote, by the way. It's a whole story. Can you take us back to that moment? What did it feel like, and when did it turn from grief into mission?
So, Aarti, I think for a very quick introduction for everybody, I'm Bhavjot. As already mentioned, I'm co-founder at Clinic. And I grew up in a very small town in Assam, which is Nagaon. And it's a place where quality healthcare is almost non-existent. And I'll come to that point about access and the quality of care and stuff like that. But essentially, when my father was diagnosed with something as simple as diabetes, like most of the families around us, we didn't know what's the best way to take care of this medical condition, right? There was no health system to support us. There was no doctor regularity. There was no guidance on how to take care of something as simple as diabetes, right? And over time, this became critical. One thing led to the other, and almost casually one day we realized that things had gone far too much into the depth of a difficult disease like a chronic kidney disease, right? And obviously, what followed was a very disorienting phase for my own family. He was the only breadwinner of the family. My family had to leave our hometown and go and stay in Chennai. They had no idea of the language. There was no insurance with the family. So they spent almost 8 grueling months navigating crowded hospitals, doctors, speaking to countless different folks, um, and trying to save his life essentially, right? And I think we lost almost a lot of savings towards making sure that we are able to give the kind of care that we can provide for him, right? And obviously, it was not easy. Um, it was hard because we lost him at the end of the day. And what was even what's even more painful for me, right, is that we hear such stories so much more casually. Um, like something happened to my neighbor, something happened to somebody we know in our family circles, to some other friend's family, right? So it's a story of millions of Indians even today, right? A system which is leaving the families scrambling, emotionally and financially tired, even in this today's day and age in this country, right? And that's unacceptable. So for me, I see that losing my father was an important journey, and the grief was more of a fuel to start a very difficult company, right? Which I think is not doing the conventional way of building healthcare, of, like just building hospitals, knowing that people who are vulnerable will come there and you have an opportunity to make a lot of big ticket size money out of it. But how do you make a, a huge successful business out of keeping people out of hospitals, right? And I think that's where clinic essentially came into being, a fundamentally different health system that this country deserves, which has not been in place so far. So yeah, that's how it all started. That's how it all ignited.
Wow, that's pretty inspiring, Bhavjot. You were a geoscientist at Shell, right?
Yes,
Uh, you're working with Shell,
yes,
working across the Middle East, Southeast Asia, Europe. Now, that's a career most people would protect fiercely, right?
yes.
And curious to know, what did people around you say when you have told them that you were going to leave everything to start a healthcare company in India? And what
Very.
made you so sure to ignore them?
I should say that um, straight out of IIT Roorkee, getting a pre-placement offer with Shell was like a dream come true for any student. I loved planetary sciences, earth sciences, and hence I had taken up geology and geophysics as my career subjects, right? And very interestingly, I got the most crazy opportunities with Shell. For example, the first project they gave me was part of 18-member execution team, which is the first commercial production of oil in post-war Iraq, right? So that meant that I went and stayed in a um, Halliburton camp, which was almost 800 to 850 men. And I was the only woman there in that particular camp. And we were literally working and executing in a very, very tough terrain, which had mines laid out. So the team would go and clear the mines before, there would be human movements. There was a lot of importance on safety. So Shell gave me a very crazy experience on the scale of operations and of global scale of oil and gas operations, right? And how things would work and stuff like that. And most importantly, it pampered me, it pampers each of its employees. I mean, straight out of college, coming from middle class families, we are then flying suddenly, business class, sometimes getting upgrades to first class, mostly traveling around the globe, worked in 12 different countries. So it's a life of abundance. And as you correctly said, it's very hard to leave behind something, which is close to your heart because you're working in like really good technical areas. And secondly, you're getting pampered as a employee of a company which is doing a lot to make sure that you're happy and you're satisfied with the work that you have. But and honestly, everybody around me was like, "You're stupid. Like, why do you leave behind a settled career to go into building in healthcare in India?" Right? Because healthcare in India, from a monetary perspective, is just about building either diagnostic chains or building either hospitals or, not doing anything apart from these things, right? And it's a very difficult field, and pharma, obviously, right? So apart from these things, right, which have tremendous amount of money, like there was no such scope, is what a lot of people think, that healthcare is a very, very difficult field and sector. What gave me a little bit of confidence is also that my co-founder, he comes from a medical fraternity. He's an orthopedic surgeon from Manipal, was single-digit PG rank securer, somebody who was extremely deep-rooted in the whole healthcare fraternity industry. So it was great to have a co-founder who could balance my lack of knowledge of healthcare, if I may. But any entrepreneur will tell you this, that you don't know about an industry till you get your hands dirty. And I think I have, like, 7 years down, I'm way more wiser. I understand this way more well. But yeah, there were a lot of naysayers. The reason I still went and I persisted was because I really believe that if I have to spend prime years of my youth building, it has to be in building something which creates incremental difference, like a huge delta of difference in the experience than what currently there is for this country, right? And I know that it's not a small attempt. If I don't do it, I know nobody else will ever try it in this country, right? We will do exactly the same system that we have. You'll fall sick, you'll go to hospitals, there'll be like huge bills. Insurance will keep getting expensive year over year. Things will not change. If people like me don't take a hard stance and say that, no, we have to build out a model where patients are winning, where even the payers are winning and on the providers are winning then. So how do you create that kind of system in India? I know that if I wouldn't put my hands into this, nobody else would. And it's a lot of people call this like a graveyard industry. So I mean, why not pick something as difficult as this and try to solve this? Because if it gets solved, generations after me will benefit, right? So I think that was the whole motivation there.
Well said, Bhavjot. Now, coming back to the clinic as a model itself, right? When you are talking about serving the missing middle part, right? The 600 million Indians that we're talking about who can't afford private insurance but won't use public healthcare.
Yes, yes.
Now, that's an extraordinary number, Bhavjot.
Correct.
But who is this? Who is your typical member in this whole model, in this whole framework?
So let me answer you by giving you at least one or two different personas of the kind of people we serve, right? So who is our member? Our member is someone who has newly shifted to Bangalore, right? Or has shifted to Bangalore as a working professional. They don't have established provider relationships, right? And for every small or big problem, they don't just want to land in hospitals. They want reliable care in their vicinity, right? Which they can trust, which they can go, and they know that they are not getting ripped off. So this is one segment of persona of customers, right? Who are looking for everyday care which doesn't burn their pocket and is very high quality, because they don't want to compromise on quality, right? Nobody does. On healthcare, you will pay more, but you will not go to any random place, and even if you are having limited means, right? Our insurance product buyer is essentially someone who has never bought insurance or a financial product like insurance in their lives. So 80% of the people who are buying our integrated product are the people who are buying it for the first time. So for them, imagine this, that in India, the perception of healthcare insurance is just hospitalization, and it is just hospitalization, right? What it gives you is that if you are sick, there's a certain promise that for certain medical conditions, you will get cashless treatment or you will get reimbursed if there is no cashless available in that provider network. it's an indemnity insurance at the end of the day, right? That's what India's typical health insurance looks like today. And obviously now, to make it more lucrative, they have thrown some tick box healthcare stuff, wellness they call it, right? On top of it. Like you'll have teleconsultations, random teleconsultations. And these teleconsultations are not like, they have your proper medical record. It's nothing to do with the medical care. It's like I call it like call center of doctors kind of a system, right? Just to make that insurance look a little bit more attractive, they'll bundle in some XYZ factors. But imagine for the people who are buying our product, just for a less of the amount of money that we pay towards, say, a good good cappuccino, frappe latte, or whatever in a month, right? You are able to get benefits not just on the hospitalization side, but also your day-to-day care is taken care of. You can walk into the clinic, any of our clinic health hub, you can walk out and you don't have to pay a single penny if you are a member. You can visit our doctors as many times as you want. They are going to take care of you remotely and while you're in the clinic, right? Because they have all your medical history. Our system's excellent, and then they can, keep track of what is to be done next with your health condition. And if you're showing a different medical conditions, we have the history to give you the right kind of diagnosis, all of that stuff. And it's game changing for people, right? For people who would think that clean, hygienic clinics are expensive, you have to wait for hours to meet a doctor. I mean, this is game changing. You're just coming, this doctor is taking time to understand your medical condition, is taking time to actually help you understand what's going on. For someone who's not so aware of their medical problems, you're getting educated, you're getting hand-holded to an extent where even me, for my personal needs, I only go to clinic while I have access to all of our, doctors. Like, for example, my co-founder himself is a orthopedic surgeon, right? But for anything health, I would go to my clinic health hub doctor first, because I know that the kind of standard of care that they're delivering is unparalleled, because they are doing it with the help of most advanced protocols for that particular medical condition. The system is helping them deliver the kind of care that yields to best health outcomes. So all of this is being possible for this segment, right? And at a price which is not burning their pocket. So how much they would pay for insurance, they are paying maybe something lesser than that, but getting a very comprehensive health offering, right? So since they're experiencing it for the first time, for them, health protection means not just health hospitalization insurance, but also my day-to-day cover, which is coming alongside that. So I would say that our segment is essentially people who are, first-time buyers of insurers. They can be Rapido captains, they can be middle-class workers, they can be new aspirational folks coming into the city for working. We started off with gig workers, but because of the kind of quality of care we have all sort of people now visiting our hubs, including people who work in startups, people who work in Google, folks like that, right? So shows that if you're providing the right kind of healthcare, you can potentially unlock a lot of value across the economic pyramid of this country.
What you said, something about the, it really stuck with me, right? That health insurance in India is a product side problem. It protects against the hospitalization, not against the slow bleed of everyday's medical costs that we are talking about. A doctor's visit or a blood test that you had mentioned. And I have personally followed this space for years, and the OPD blind spot in Indian insurance has always frustrated me. And I'm genuinely glad that someone is finally attacking it structurally, if I may say.
Yes,
But
yes.
I'm pretty intrigued to understand, why hasn't the industry fixed it already? And it's not a new problem for us.
It's a very detailed answer, to be honest, if I have to go into this detail. But if I have to just explain from a very concise and from a layman's perspective, think about it from this perspective, right? OPD is unglamorous. It's structurally, as you use that word, hard to monetize at scale. right? Because it's low ticket size, high frequency, operationally heavy, all of that stuff that people find unglamorous, hard to scale, this and that. Everything exists with the system with OPD. And you need the infrastructure, you need real doctors, you need the real system which can help in follow-ups and not just a claims processing engine, right? Insurers, they generally don't like it because the margins which are unlocked are very thin, right, for them for per transaction. Hospitals obviously don't, for them, OPD is just like a funnel to fill their beds, right? Because for them, the metric is, we all know, right? Occupancy
Yeah.
of beds, right? So the industry is now split, right? There are two unsatisfying halves, if I may. The insurers who are covering for catastrophic because OPD is too thin margin and expensive for them to be processing all those claims, setting up those networks. They are essentially in India a financial tool, a financial expertise, and getting into like the provider part of it is not their forte, right? They're great at financial actuarial sciences. They are not great at providing care, if I may, right? While OPD is generally a system where the actual reality is that if you are unwell, you need real doctors, real care, and it's still a lot which is happening in this country is out of pocket and it's very unorganized, right? So at Clinic, what we are trying to do is do something of this together, right? Provide the OPD access and wrap the IPD protection around it in a single product. Because insurers, as I said, just to wrap it up, may not find it economically viable and also from their skill set perspective alignment, although they would wish, and they are very much aligned on the fact that if there is primary healthcare, if the claims are reduced, they would benefit a lot, because most of the claim payout that they are doing today is because of acute and chronic illnesses which can be prevented to a great extent, right? So it's a very great situation for them to have a fronting layer. And that's why you see a few people in India now coming up with managed care, etc., right? Because there is a certain awakening of sorts. But obviously, hospitals, they don't like it. They're like, it's like killing their own business, if I may be brutally honest, right? OPD is not the cash cow, if you call it cash cow for them. So yeah, that's why the system has been so disorganized, and nobody has really built it the way it should be built from scratch, right? And also, if you have to look at the way healthcare and insurance have evolved in India, they have evolved in two different paths, in very different ways, right? So I think there's also a little bit of genesis to how the whole systems have evolved, and now we are predominantly a fee-for-service model. The more you're sick, the better it is for the system to make money out of you, right? At least the hospital system. So yeah, I mean, it's a tough nut to crack. Otherwise, as you correctly said, a lot of people would be doing it. But having said that, I do hear a lot of new age insurers now awaken to this, that yes, I mean, if we have to build like sustainable portfolios, we will have to take care of not getting a small dengue related case hospitalized, which could have otherwise been taken care of in a clinic, right? So yeah, I mean, that's the structural and also intentional issue. I think both exists here.
That it is. You're right. Help me understand, Bhavjot. So what you're saying is clinic essentially bundles the OPD care plus hospitalization into
Yes,
one subscription, right?
yes,
Um, Unlimited clinic visits, care within 15 minutes, and then an insurance backstop. Now, and added to all this, you're talking about not all these managed services, not through an app, but through physical health hubs, clinics you actually operate.
yes.
This, for me, isn't it capital intensive, hard to scale fast? Um, can you just quickly walk us through the how does the economics actually work? How do you make money while keeping cost near zero for a member?
everybody thinks this, that clinics are high capex. To be honest, like these are structurally small units. We man it with GP who has a lot of technology empowered with him or her, so that they are able to give high quality protocol-led care to anybody who walks into the doors and make sure that each and every person is getting the health outcome they deserve, right? So the essential math for any business to work is how do you keep the cost of delivery super low, right? See, we had to price it in a way which was affordable to the mass market, while we still have very healthy gross margins as a business, because the cost of delivery for us is very, very low. And I think the whole business is geared towards making that cost of delivery low, using AI, using technology, making sure that the doctors are empowered to be, giving care consistently at scale. The other thing is that since again, it's all technology led, everything, be it our inventory, be it our, the entire supply chain is then again linked to the diagnosis, right? We have everything that we do, which is standardized and standardized to the T. I think for us, that's the thing, right? So if I have to just, without giving out numbers, very quickly say that we enjoy very high gross margins as a business. That's just because we control the delivery. And if you control the delivery, you control the cost. And that's the reason why we have our own clinics, because we have huge kind of influence on the way every single thing moves inside the clinic, right? Every fulfillment, how it's tracked, how it's done, how the care is given, everything is highly, highly controlled. And the other thing is also because of the technology, we are able to task shift a lot of things, right? People would say that you just have MBBS doctors or GPs, right? But to be honest, our GPs, they are equipped with such a world-class technology and which is enabled by AI, right? That they are able to sometimes deliver and a lot of times deliver care which otherwise would need or beg for a specialist, right? Without obviously impacting the health outcomes, right? So the cost of delivery for us essentially again is lower because of the huge usage of technology that we have. To a certain extent, I like saying that we have productized a service like primary health. And I don't like using the word primary healthcare for clinics anymore because I call it like frontline care, right? We have evolved from being a sardi khasi ka dukan to being something even more complex than that. We are able to treat chronic patients. We are able to do a lot more with our clinics than a general GP would outside of clinic network, right? And all this has been possible only because of the control on the care delivery, which is again using technology. I mean, these all are things are possible today. They would not have been possible, say, even 5-6 years back, right? So we have been able to leverage that to an extent where, it doesn't, the economics actually, like the cost of delivery is only shrinking every day because of the kind of interventions that we have built in place. The other thing I should definitely say is that since the form factor of the clinics is like not extensive, right? We are not building hospitals here. I mean, I joke that we can build almost 10,000 clinics in the cost of building like one 600-700 bed hospital, right? So that's the kind of scale that we can achieve with like the form factors that we have. So asset heavy is a definition which will change depending on who you are and what kind of asset are you talking about. I don't see them as asset heavy at all. I mean, it's actually like planting a clinic for us is cheaper than hiring a mid-size, or running a clinic is cheaper than what I pay for getting, say, a mid-level front-end engineer. So it's not too much. And they're all profitable.
Okay, they're all profitable. You're currently in Bengaluru and Hyderabad, right?
We are in Bangalore, yes. But see, we have a digital product which serves the rest of the country. That's how we know, we learn about healthcare trends of the rest of the country. But our own clinic health hubs, they exist in Bangalore.
So the temptation to go national must be enormous, right? Especially with investors pushing. How are you thinking about expansion? What are your plans and what's holding you back from moving faster?
See, we are building a vertically integrated system, right? So the more density you have in a certain geography, the more leverage you have, be it the operating leverage, be it the trust leverage. It's almost stupid to go thin in this kind of a model, right? So you would build geography by geography. You will build in a way that you conquer one geography, move to the next one. So right now we believe while we are deepening our scale in Bangalore, the next phase looks for us is not going to 10 more cities, but maybe going to 3 more cities, right? So that's the way we are looking at scale, because at this point, what we are very fairly confident of is that no matter if it's the first consultation happening at the clinic or 1 lakh consultation happening at the clinic, we have done more than, like, I think 2 lakh consultations now in clinics, more than that. But our NPS is like 90, which is very good from an industry perspective. And you should just go and see the reviews that our people give us, right? I mean, we don't go and preach them about anything. We don't do marketing in terms of the brand marketing, because I believe that doctors shouting on top of their voices and saying that our clinic is the best is not the kind of doctor you would essentially go to, right? You would go to a doctor who your friend tells that, oh, yeah, I went to him and or her and I really got a good treatment. So
That
balancing
still
that
works
was
in
the
India.
most, balancing that was the most crazy part. I mean, holding your horses back and saying that till we achieve that minimum scale, we are not going to do stupid things, right? And we'll be slow, but we know that, that scale for us will come together and will come very soon. I think we are at that inflection point at this point where we know that the care will be consistent, and that gives us confidence to scale to other cities, right? But I think even then we will build more clinics in Bangalore itself as we scale to some other tier ones.
Great. One last question before we move to the rapid fire, Bhavjot. You're in a room, frankly, with the industry leaders, policymakers, and fellow founders, right? One door you would like to be opened up. One thing this room could do for clinic, for the healthcare ecosystem you're trying to build. What could that be? What is it?
I think managed care in India is a new idea, right? I think that's something where I believe that the industry can step in, where um, policies which are favoring rollout of companies like us becomes way more favorable, right? So I think that's something which I feel the industry will need to work together to address, where we are able to actually bring together um, the insurance leaders, the healthcare leaders, with startups like us to actually devise what healthcare will look like for tomorrow, right? It will definitely not be the same healthcare like it was today. And if you have to work towards the healthcare of tomorrow, what are the things that you would do differently today in terms of the policies that you make? So I believe these are things where industry should take cognizance and actually shake itself up and see that if there are ways and avenues of building out newer models of care delivery in this country, right? How do you build policies around that? How do you kind of actually help companies like us to succeed? So I feel that's where the industry consortium can help the most.
Quick rapid fire, if we may, before we move on to everyone who is participating, joined us here, and we'll open up for the Q&A.
Sure.
Let's start. Okay, one founder you admire.
I admire many founders, but recently, obviously, like everybody is going to say Elon Musk, so I'll go with him. And Mr. Narayan Murthy, hats off to him. Like, I met him once in a airport lounge, and I was like astounded by his simplicity and how grounded he is for what he is. I think that humility is something which is very hard to come by. So I do admire him a lot. I people see Elon Musk as a trillionaire, but I really believe that the picture of his when Falcon failed, right, is a picture every entrepreneur should actually like print and post it near them when they see the debris, and they're like, you have to rise up again and again and again. Building something for the long term, right, is not easy. And these are the kind of entrepreneurs I admire who are building for the long run and not for like short term, whatever is the trend of the market, raising capital and then moving away to something next.
Fundraising or hiring, which causes more sleepless nights?
Sorry,
Fundraising or hiring, which causes more sleepless nights?
if you're a hugely loss-making company, then you are going to have sleepless nights because of fundraising. I think for us, the right hiring is a very important thing, I feel. I mean, I would not hire wrong at all. I've learned it the hard way. So I wouldn't, like, I know if you're doing the right things, investors will follow. But I do believe that for me, the sleepless nights is more on the hiring front. If we have to hire a critical hire, I mean, that's important to crack.
AI tool you use most often.
Claude, anytime. I'm mostly on Claude. Yeah, not
Okay.
ChatGPT as much, but yeah, Claude. Yeah.
Okay. One healthcare myth people still believe.
I'd be hated to say this, but homeopathy. Yeah. I mean, going to homeopathic doctors, or rather for certain medical conditions, going to even quacks for that matter, right? I mean, that's something which you would be surprised to see, but a lot of even educated Indian families today go to quacks for things which are like non-scientific and stuff. I mean, that's not cool. I think that should be debunked.
Okay. And the last one is, if Click doesn't exist, what would you be building today?
If clinic doesn't exist, what I would be? I'd be
Clinic.
building something. I'll definitely be building something else. I would not be building something maybe in healthcare, but but in impact space, or maybe in healthcare in some other vector in space. I don't see myself not building something. I mean, that's not who I am. So I like, yeah, I'll be building something. I don't know what that something would be because clinic doesn't give you time to think about that, but I would be doing something else if not building something else if not clinic.
Okay, that ends our rapid fire questions. I'm going to open it now. Request all of you to make it a one-line question. Pavjot's time is absolutely precious, and we'll take it from there. Do we open up for the questions here?
Questions from audience are posted in the chat box for you to take it up. So you can take
Okay.
it up with speak.
There are quite a few. Let me just. I like this one. What does the future of primary healthcare in India looks like over the next decade? Pavjot, would you
Can I
like
answer
to
that?
take? Yeah.
That's something which I keep constantly thinking about. So I mentioned it very briefly. With technology moving the way it is today, right? There are two things which will happen parallelly. One, if you see compared to your previous generation, right, you're way more health aware, right? There will be a lot of focus on preventive and promotive care, not just the frontline primary health care. So that's one thing which is definitely going to come. The other thing which we will see and which we're already seeing, at least with clinic, is that your average doctor will be able to do a lot more outside. What obviously there will be things which will require a hospital setup and complex care and all that can never be like substituted for those medical conditions. But whatever can be done in a doctor cabin setting would be done in a doctor cabin setting. I mean, I would say that the doctor would be enabled to treat way more conditions. And the whole definition of primary care will also expand. It will become the frontline care, right? The first point of care that you get to when you have any problem with health, and then you get directed to like a tertiary care or a secondary care basis the kind of diagnosis that the frontline doctor comes and arrives at. I think that's the future of primary healthcare. It'll not just be a primary healthcare, it'll be way more expansive than that.
Okay. And as an extension, what skills will future healthcare professionals need beyond clinical expertise?
I think the way things are getting evolved now, there are two skills which are going to be undeniably important for the providers of tomorrow. One will be how, and this is like a skill, or call it a skill, call it something which is ingrained in the providers, like because of the Hippocratic oath that they take. You have to do good by the patient. You have to be nice and empathetic to the patient. As the technology evolves, what also happens is that whole human connection, human relationships become even more important and valuable, right? So they will have to be very good with people. They will have to be very good with um, their patients, like the way they talk and all that stuff. They must be good even now, but I think that's one skill that they will have to keep making a lot of progress on. The other thing is they will have to be technology first. I mean, gone are the days when, a doctor can just scribble and give you a paper and, just go away. You will have to know how to actively manage your patient's health, and for that you will need to be able to be technology aware, and you need to be using tools which will help you guide the patient in the long run, right? So you will have to be tech savvy, you will have to understand the new modern tools, and you will have to be very good at managing relationships, even by uh, being extremely empathetic to your folks who are walking into the doors of your clinic.
One question that I also would like to know is what factors are critical when deciding where to establish a new clinic?
Okay, this is a very see, this can be answered from many different fronts, okay? And then like we have a playbook on this in the company, right? So it's a very detailed question, but where, as in if you're talking about geographic where, then it obviously depends on what your model is, right? If you're a specialist, or if you're a single doctor clinic, or if you're a super specialty hospital or secondary care hospital. So it all depends on who you are and where you want to go next. Say, for example, us, right? We would want to be present in tier 1 locations. And because we believe that there's a lot of uninsured population in tier 1s, which we want to address. There's a lot of gig worker population. Then there's a lot of MSME population. We also want to be present equally in future. We would definitely want to expand to tier 3, 4, rural talukas, sub-districts, etc. as well, right? But we would want to begin our journey with tier 1s. The other thing is, if you're talking about location in a neighborhood, again, depends on your practice and depends on what your catchment is, right? Depending on who you are, there are different scouting methods for the right locality of your clinic. I think these are extremely detailed things, right? I mean, like for us, we have a huge checklist of almost like 30, 40, 50 plus items where we see what doesn't. So we have learned so much with opening and closing of clinics that we now know where not to place a clinic, then where to place a clinic, but that works for a health system like us, right? So it totally depends. I mean, it's a very generic question. I cannot answer without having the full context of, what they're meaning, like where to go with your clinic, because that totally depends on your practice, your business model, and what you're trying to achieve out of placing that clinic, right? So sorry, I'll not be able to be like too specific on that.
No, this is great. There are a lot of interesting questions. If I may, we will try and answer them over an email or through a WhatsApp or in any other medium. Please bear with us on that one. In the paucity of time, we have to end this session while we want to continue to discuss, stay connected with Bhavjot. Bhavjot Kaur, a geoscientist who came home, lost a father, decided that 600 million people deserved better. An IIT Roorkee alumni who could have done a lot of other things, who could have gone anywhere, and chose to come back and build for the 400,000 families who needed her most. That's the startup story worth talking about, discussing, and telling. Thank you so much for building what you're building, Bhavjot, and for sharing this with us today. Please join me in thanking Bhavjot Kaur. Thank you. And
Thank
for
you.
everyone,
Thank you for having me,
please,
Aarti.
just one quick operational thing. Sure, go ahead.
No, I just said thank you to CII, Mr. Ravikant, Aarti yourself for conducting this. These are moments where we also get to sit back and reflect on a lot of things. So it's been valuable for me as well. Thank you for being patient. Yeah.
Thank you. Thank you so much for your time. For everyone, Thursdays, 5 p.m. is the Startup Buzz session. Please dial in next Thursday for another interesting topic. Thank you. Bye, everyone.
Bye. Thank you.